Hi, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. First of all, I thank you all for loving my videos. If you haven't subscribed my channel yet, please subscribe as you will get the latest updates on my channel if you subscribe it right now. In this video, I'm going to share techniques regarding information gathering that is an important criteria in communication OET speaking. Now, what are the points to be followed here? First of all, it is facilitate the patient to speak without any interruption. That is, use active listening techniques. Here you should minimally interrupt the patient by just using the expressions ooh, ah, I see, I can see. So I'm going to explain this in details after this. Second is, it is imperative for the candidate to ask relevant and appropriate questions according to the role play. Third is, clarify vague information. That means you can ask the patient by these expressions, can you please explain it in a bit better way? Or, I want to get more information regarding this. Then the last is summarizing the patient's response. You may make a summary what patient has explained you in a clear tone. Now, let's have all this in detail. First, I'm taking active listening. Actually means that you are attentively listening to the patient. Here you should give some expressions like oh, ah, okay, I can see, I can feel, I can realize. Yes. So you can use some empathy phrases like, I can realize how difficult it would be for you. I can understand how you might be feeling at this time. I can clearly feel your pain. Now second is asking relevant questions. It is crucial here to ask relevant questions according to the role play. For example, if you have a role play where the patient met with an accident and need to have stitches, you should just ask the question related to the current condition of the patient. For example, it could be, can you please explain me a bit more about the accident? How did it happen? Did you apply something on the wound? Can you please rate your pain on the pain scale of 0 to 10? Do you have any other health issues? Here, the big mistake students usually do, if they ask irrelevant questions like his lifestyle or any hereditary or genetic problems, because it does not have any relevance here. It is significant to ask open questions and to discover information from the patient's experience and perspective. For example, if it is a role play of health hazards like obesity, diabetes, high blood pressure, high cholesterol, or anything like that, then the question related to his diet, exercise, occupation, habits, these need to be asked by the candidates. For example, could you please tell me about your occupation? What type of diet do you take? Do you do exercise? Would you mind telling me more about your habits, like it may be his activities, or you may ask him regarding smoking and alcohol consumption. Now let's see what type of closed questions can we ask after getting this information. So it could be, do you smoke? How many cigarettes do you smoke? Have you ever tried to quit smoking? Can you rate your pain or on the pain scale of 0 to 10? Have you taken any medicine to relieve your pain? While gathering information, it is important to avoid certain type of questions. These are compound questions or the leading questions. For example, asking 2 questions at a time. As usually candidates ask, do you smoke and consume alcohol? What do you do to relieve your pain? And what triggers it? Now let's see some leading questions. For example, Would you say that you don't take balanced diet? Or would you say that your asthma gets worse by using perfumes? Can you tell me something about your diet? Now, see, in this case, the examiner or the interlocutor or the patient will be confused and will not be answer the questions properly. Now let's come to the most crucial part of the information gathering, that is clarifying or clarification. So here, what type of question can be asked? Can you make it more clear? Or I want to get more information to check that I have understood it correctly. At last, the best technique is summarizing the whole information in your own way. Let's see some examples. So by our conversation, I have come to know that you started experiencing pain in your abdomen after dining outside, and that followed by diarrhea. Do you want to add something more to this? So this could be after you gather the information from the patient and now you're just summarizing all this. So if the patient need to tell you something more or to add something more, he or she should add this. In this way, you can fulfill the most important communication criteria, that is the information gathering. Hope this video will help you to gather information from the interlocutor in the form of patient accurately. Stay connected. If you haven't subscribed our channel till now, please subscribe it first so that you should get latest updates on our channel immediately whenever we upload any video or short on this. Don't forget to like and share the video. Thanks for watching.